It's a pill that led to the standing ovation at the American Society of Clinical Oncology meeting in Chicago this spring, one of the biggest oncology conventions in the country. Clinical trial results of the oral treatment known as daraxonrasib showed it can nearly double median overall survival for previously treated metastatic pancreatic cancer patients compared to similar patients who only undergo chemotherapy.
So when he presented the survival data, people stood up, and it's not common, I think, for people to get interrupted in the middle of their talk.
Dr. Andrew Kovaler is director of the Pancreatic Cancer Specialty Clinic at Fred Hutch.
It's a cancer where no one has thought anything was going to work.
But the new treatment developed by the drug maker Revolution Medicines does seem to work quite well.
When you get cancer like this, it's a palliative, so you're targeting quality of life.
Lance Anderson is taking daraxonrasib to treat his stage 4 pancreatic cancer. He caught the cancer early in 2020 when he noticed he was jaundiced. Doctors later diagnosed him with stage 1 pancreatic cancer.
But pancreatic cancer is pretty tenacious, and some molecules stuck with me, even though it was very early.
In 2021, Anderson, a retired chemical engineer, started going to Fred Hutch for treatment. He eventually moved to Bellingham from California. Despite early detection and chemo, the cancer still managed to spread to his lungs and his eyes. But none of this stopping him from doing what he loves.
I grew up in Wyoming, and the Bay Area was just getting more and more busy. Hard to get to the mountains, hard to go skiing, hard to do everything. So we moved to Bellingham so that we could have an outdoor life, and it hasn't disappointed.
Under the guidance of Dr. Kovaler at the Hutch, he was recommended to get on a clinical trial of the pancreatic cancer pill, which involved fewer chemo sessions.
My son's only 13, so the longer I can survive, the more mature he will be.
Anderson has been on the treatment for a year now.
The chemo treatments alone would have become much less effective already. But because I'm on with the drug and less chemo, it has extended out.
The drug is a medication that targets a protein called KRAS.
It's opening up a whole new way to do something and what's going to likely be less side effects and a better way to do it. So it's what comes out now and where people can see it going in the future that's both exciting.
Lance Anderson understands the pill is not a cure. What it does offer is time. More time to continue climbing.
More is better, curative is better, but they're making strides in cancer treatment now. Now, whether I'll live long enough to experience all that, we'll see, but that's what I'm hanging on for.
For HealthLink, I'm Christine Pay.